So examine the skin of the horse, the summaries, the findings, and explain how to take skin biopsies from horses. So the steps of dermatological diagnosis. So you have the chief complaint, the signalment, the dermatological history, the medical history, the clientele credibility, the physical examinations, the differential diagnosis, the diagnostic and therapeutic plan, the ancillary diagnostic methods, the trial therapy, and the narrowing of different diagnoses. So the physical examination, you get your basic clinical values and do the root physical examination. And the lesion types, you have primary and secondary, and the localization of the lesions. So specific localizations for viral lesions, the predilection sites of parasites, and specific anatomical localizations of tumors, which are around the groin area. The skin lesions. The entire surface of the skin can be observed and palpated. So the primary lesions are the macules, the plaques or the papules, the vesicles, the pastules, the urticaria, the nodules, the tumour, and the cyst. The secondary tumours are alopecia, scaling, crust, scar, erosions, ulcer, liquefaction, fissure, hypo or hyperpigmentation, and necrosis. So the ancillary diagnostic methods. So you have hematologically for systemic inflammation, biochemistry for photosensitivity, skin scraping for parasite diseases, hair follicle samples, brushing for arthropods, sellotape for oxyurosis around the anus, and swabs or aspirations for fungi, bacteria, and parasites, and skin biopsies. For skin biopsies, you can have multiple sites for new lesions without clipping or surgical preparation. The types of skin biopsies are shave biopsy, a punch biopsy, a wedge biopsy, and an excisional biopsy, so SPWE. The indications for a skin biopsy is to establish specific diagnosis, to rule out differential diagnosis, to follow the course of the disease, and to confirm the completeness of a tumour excision. So how to take a skin biopsies. In most cases, a punch biopsy is satisfactory. Use a 6mm diameter biopsy punch. And in the case of a large lesion, it can be obtained by excision, and they're put in 10% formalin. And if immunofluorescence is required, then fixatives such as Mickels should be used. A wedge biopsy, so use a blade of 11 or 21 to 25 and cut off the lesion. An excisional biopsy under general anesthetic, it should be removed. An X-ray or ultrasound can be used to find the tissue, and a shave biopsy. Shave biopsies for diagnostic tests, and the skin is examined under a microscope.